Why I chose to practice at the Everett Clinic. For one thing, their reputation. They have an excellent reputation in the area. And when I had first moved to Washington State, I was working at the small hospital up in Arlington. And I was looking for something that was a little bit bigger, that was a little bit more secure. And honestly, Dr. Frost, who's also in our department, asked me if I'd like to join. And since I had a lot of respect for him and he's an excellent surgeon and a good friend, I thought that that would be a good fit for me as well in that department. So not only the security and the size of the clinic and the reputation, but also the camaraderie I had within my own department is what led me to join the Everett Clinic. The first thing I would tell a friend if he asked why they should go to the Everett Clinic Orthopedic Department, the first answer would be is because you can't go wrong. There's not a bad doctor or a bad physician's assistant there. They're all excellent. I would trust any of them with my family without batting an eye. There's also a sense of collegiality amongst us, in a way a built-in second opinion. If any of us have a question about a certain patient or a certain circumstance, because we get along so well amongst us, it's never an issue to turn and ask any of them, what would you do with this person? What would you do in this situation? I think that makes us unique. I know a lot of departments may have a lot of doctors in them, but they don't always get along so well. We are friends as well as colleagues. We trust each other closely and trust each other's opinion closely. So I think that that makes us unique as far as a lot of other departments. What are the top reasons someone should come to the Department of Orthopedics at the Everett Clinic? A couple of reasons. One is, again, our collegiality and our camaraderie and our expertise lends itself to pretty much all orthopedic problems. There's very few things that we cannot handle within our department with our local expertise. Secondly is when you get into the orthopedic department, not only are you seeing the orthopedic department, you're also plugged into a big system. So if you need a knee replacement, but you've had a history of heart problems and need a cardiologist to have the surgery done safely, we can send you to our cardiologist. If we see you and figure that you don't need surgery, but you may be better served with a rheumatologist or a physical medicine rehabilitation doctor, we have all that readily available and we have close relationships with them. And with our electronic medical record, getting information back and forth on your situation is seamless. We don't have to wait for a faxed report. We don't have to make an extra phone call. I can look it up at midnight if I wanted to on the computer. That's unique to the Everett Clinic. So if you come to the Everett Clinic Orthopedic Department, not only will you have good local expertise to cover pretty much anything you need, but you also can get other specialty care if needed.